I'm Mrs. Princey, Associate Professor in Mental Health Nursing. We have got an important therapy which is given on a one-to-one basis, right? So we have got various clients who will be having a lot of issues, a lot of problems, who may not be freely be able to explain or ventilate. So in those conditions or in those situations, we opt for a therapy known as the individual therapy. So today the topic is individual psychotherapy. Individual psychotherapy is nothing but it's a method to bring about a change in a person by exploring his ideas, his thoughts, feelings, thinking, and behavior. It is a process of meeting with a therapist to assist a person in dealing with symptoms or problems the person is facing or that he is having. So you can simply say that it is a process wherein we have got two people, one as a therapist and the person or the client, wherein the client is going to meet the therapist, wherein he is going to ventilate all his thoughts, ideas, feelings, and emotions so that he will get the help from the therapist. Okay, so this is about the definition of the individual psychotherapy. Moving on to the goals of these individual psychotherapy. Number one, to remove or to modify the existing symptoms. So we are going to bring about a change in the person. We are going to modify the experiences of a person. We're going to remove all the maladaptive behavior in a person. So we are going to bring about a change in the symptoms or behavior of the person. The second goal is to meditate the disturbed pattern of the behavior, right? So you're going to make the person understand, you're going to make the person to realize what are these patterns of the maladaptive behavior which he is having. So that is the second goal of the individual psychotherapy. The third important goal is to promote the positive personality development in a person, right? You're going to overall develop the positivity in a person which leads to the growth of his personality. So these are the goals of the individual psychotherapy. Moving on to the indications of individual psychotherapy, in what conditions that you can opt an individual psychotherapy. Number one, in case of personal growth and exploration. So personally, an individual needs to develop his personality. He needs to understand himself, go for an individual psychotherapy for the personal growth and exploration. The second is in case of any kind of spiritual related issues. So person is having some matters which are very much stressful for him related to the spiritual aspects. He can talk to a therapist so he can solve his spiritual issues. The third indication is the life adjustment issues. So if the person is having problem with the adjustment problems, especially the teenagers or the developmental stages which requires adjustment to each of the development stages can end up with the problem. So those issues which can be solved through the individual psychotherapy. The next thing is coping with change. So there we have got various situations which requires change. Okay, change is going to cause a problem in a person. Some individual will be able to easily adapt. Some individual may take it as a stress. So to deal with those stress or to cope with those stress very difficult. So at times we may require the help from a therapist. The next indication is in terms of grief and loss. So any kind of a loss, any kind of a grief reaction or a grief process or a situation, a life of a person can require and need for the help from a therapist. The next one is the past trauma. So previously or earlier stages of the development, earlier previous experiences, okay, traumatic experience the person had in his life is not able to cope up with those, he requires the help from a therapist. Any kind of a relationship issues, relationship problems with a couple, okay, which may require a therapy in terms of the marriage therapy or a couple counseling, it is an requirement they go for an individual psychotherapy to solve the relationship problems. The next indication is the adolescent issues. So during the adolescent period, during the pubertal period, there are a lot of changes which happens due to the influence of hormones, due to the influence of the peer group. Okay, the influence negative impact in a person in an adolescent age group, wherein he may seek the help from a therapist. The next is the depression. In case of depression, a person may try to ventilate his thoughts, his feelings to a known or a trustful person. So in those cases also he may opt for an individual psychotherapy. The next indication is in case of anxiety disorders, any kind of anxiety related disorders, the sexual issues, okay, wherein you cannot communicate with anybody, you may require a therapist. So you opt for individual psychotherapists to deal with the sexuality issues. Stress related problems, so in those cases also individual psychotherapy is indicated. The last one is the alcohol and drug dependence. So people who are addicted to the alcoholism or to any kind of a substances may require an individual psychotherapy to come out of it. So these are the indications of individual psychotherapy. Moving on to the therapy process. So how the therapy happens, so we're going to see that. Individual psychotherapy is conducted on a one-to-one basis. So that is here we have got a therapist who's going to deal with one patient or one client at a time. Here, the patient is encouraged to discover himself as to why he is showing or exhibiting these kind of the behavior. The role of a therapist here is a very good listener. He listens to the patient and he offers the explanations for the behavior that he has exhibited, and also at times he may give some advices or suggestions to the client. So by this, the patient will be able to get a better understanding of himself and he will be able to come out of his problem. So that is the overall therapy process which is happening here in the individual psychotherapy. Moving on to the types of the individual psychotherapy, we have got a list of individual psychotherapy. Let us see about it in detail. The first one is the psychoanalytical therapy. So the psychoanalytical therapy here is nothing but whatever the person had stored in the unconscious level of his mind, okay, is repressed in the unconscious level of his mind. Maybe it can be his motives, desires, painful experiences which cannot be expressed out, is stored in the unconscious level. So through the psychoanalytical therapy, we have got techniques of dream analysis, free association, abreaction, hypnosis. We are going to make the patient to become aware about all these conflicts. We are going to bring about an insight in the patient, and to the level of the consciousness, these painful experiences or thoughts are brought and he will be able to deal with it effectively. So that is what is happening in the psychoanalysis. It is an individual therapy. We have got a therapist, we have got the client. So one to one the therapy goes on. So that is the one of the individual psychotherapy. The next type of the psychotherapy we have, which is the supportive therapy. Supportive psychotherapy is also one of the individual psychotherapy wherein the therapy is given to the people who are having chronic psychiatric debilitating problems, okay, wherein they may require continuous support to come out of these mental issues. So that is the supportive psychotherapy. The next individual psychotherapy is the hypnosis. So hypnosis is one of the treatment modalities wherein you're going to bring about alteration in the patient by putting the patient to an altered state of consciousness by continually giving the repetitive auditory stimuli, like say for example you're going to relax, you're going to relax. Okay, so it is a monotonous auditory stimuli that you're going to give to the patient, and through this, you're going to bring about a relaxation in the patient and you're going to give the therapy. So, this is what is the hypnosis, which is again one of the psychoanalytical therapy. Hypnosis involves mainly three factors. One is we have got the absorption, second is dissociation, the third one is suggestibility. So first thing what you're going to do is the absorption. So in the absorption, you're going to give a monotonous auditory stimuli to the patient by making him to continuously experience that you are relaxed, your eyelids are becoming heavier, you're in a state of relax. So that is the absorption thing which the patient is going to do. Then the next one is the dissociation, wherein the patient is going to dissociate or separate his unconscious conflicts and the conscious life of the person. So he is going to segregate, or he's going to get an awareness about the unconscious conflicts and the present situation. Third one is the suggestibility. Here the therapist is going to suggest few things so that he tries to overcome the unconscious conflict. So these are the three factors which are involved in the hypnosis. The next type of the individual psychotherapy is a reality therapy. It is a form of the psychotherapeutic technique which focuses on the present behavior of the patient. The patient will be able to focus on the present scenarios, on the reality, what are the various stressors that he is facing, and how to face or cope up with those stressors for having a healthy life, right? So, reality therapy is nothing but presently what are all the situations that he is undergoing, what are the stressors that he is undergoing in the present life, in the reality, those things will be dealt with. So that is the reality therapy. The next type of the individual psychotherapy is the abreaction therapy. So, abreaction therapy is a process of bringing out the repressed materials to the level of the consciousness, right? So, whatever the repressed material or conflicts had happened in the life of the person, especially the painful experiences, will be brought to the conscious level of the mind and will be dealt with. The person here is made not only to recall those painful events but also relive that experiences in a life manner, which is going to express it out through an emotional response, right? So when he is trying to reveal those out, or when he is trying to put it out, paint it out, he is going to have an emotional response in terms of crying spells, in terms of shouting or anger. So all those painful experiences which he had stored in the unconscious mind just comes out to the level of the conscious mind with the proper and appropriate emotional response. So that is called as the abreaction therapy. So these are the various types of the individual psychotherapy. Moving on to the advantages and disadvantages of individual psychotherapy. Yes, even though we have got so many benefits, right, we have got even the drawbacks. So let us see firstly the advantages of the individual psychotherapy. The individual psychotherapy can be set quickly, right? So it doesn't require much of preparations, just require a consent from the client and the therapist that he can help the client out. So it can be set up very quickly. The second benefit here is the patient can talk to a trained professional or a trained therapist. So he may not be having the fear that whatever he is trying to explain or ventilate will be shared to the other people. No, so in confidence it will be maintained. So because the therapist here is a trained professional. Through the individual psychotherapy, the therapist will help the client to define the various problems that he is facing. He is going to bring about an insight or awareness to the client. What are the issues, the problems that he is facing, and to how to overcome those issues. Another important advantage is going to improve the communication skills from the therapist point of view, right? So the therapist will gain an experience as to how to have the communication skills, how to maintain the rapport, how to develop the trust. Even the client will have the improvement in the communication skills to express his feeling. The last advantage is through the individual psychotherapy, it will enable the therapist to teach the coping skills or the coping abilities. So, various situations the client may experience, right? So, how to deal with these various situations, how to cope up with these situations. So, those things will be taught by the therapist. So, these are some of the advantages of the individual psychotherapy. Moving on to the disadvantages. Number one is the client can talk here, but he cannot make the real changes, right? So he may spend a lot of time talking to a therapist, okay, trying to get the support or trying to get the suggestions from the therapist, but in reality it may become a difficult task for him to bring about a change. Okay, so that is one of the disadvantage to the client. The second disadvantage is if the client is very much reluctant, he is not willing to express or is not having the motivation to communicate his feelings, then this individual psychotherapy is going to become a failure. The third disadvantage is the individual psychotherapy may not provide much help what is required from the client based on the severity of the problem. Maybe for the clients a very severe problem, but the therapist may not be effective in dealing with those severity of the problems, right? So these are the disadvantages of the individual psychotherapy. Moving on to the role of nurse. So what is the responsibility of a nurse in the individual psychotherapy? Number one, she is going to have a role to reinforce the positive behavior. Yes. So the client and the nurse, again, they're going to build up the communication, build up therapeutic relationship. The nurse is going to reinforce the client positively to adapt to the behavior which are very healthy. As a nurse, she is going to coordinate with the other team members in the mental health team. So she has got a responsibility of a coordinator to coordinate with the client as well as the other team members, maybe a psychiatrist or a counselor, psychotherapist, various other therapists. So she has to coordinate with the team members. The third responsibility is to allow the client to make the decisions. Yes, at times it's very much necessary that you give us the time to the client to make his own decisions, so that he will be motivated to make decisions in his life individually. The next responsibility is to explain about the treatment. Yes, so you have to be with a client, give them education, the psychoeducation in terms of various treatment options, why a psychotherapy is going on, what is the reason, what are the benefits. Okay, so you're going to give the complete explanation about the treatment procedure. You've got a responsibility to develop the trustworthy relationship, the professional relationship with the client, so that only when you develop that kind of a trust, the client will be able to express his feelings, which in turn is going to help you in planning the treatment. The last responsibility is you're going to set limits on the unacceptable behavior. Yes, the patient is abnormal, patient shows the behaviors which are not accepted, but every time you cannot accept it. You have to set the limits onto the patient when he shows the unexpected behavior, which in turn can be a harmful thing for the client himself and to the other clients and to the professionals also. So your role is to set the limits on the unexpected behavior. So these are some of the roles of the nurse. Yes, so this is about the individual psychotherapy. Mainly it's given one-to-one, okay, wherein the client and the therapist, they discuss, they share their ideas, okay, the client explains all his issues and problems. You've got a therapist to help him out to overcome his issues, cope up with the issues that he is having, so that he can live a healthy life. Hope you all have understood the topic.